Hey Aurora, how are you?
Good, you?
Good. Did you have a happy Halloween?
Well, I had class last night, so I didn't get home till like 10:30.
Oh, that's sad. Next year, next year.
Yeah, but I did do like over the in California, like Day of the Dead is pretty big.
Oh,
So this weekend I went to like different like Day of the Dead events, so that was pretty cool.
that's cool.
What about yourself?
Um, I was supposed to help my neighbor's kid with his project, and I showed up at his house, and he went trick-or-treating, so
Oh.
I was kind of surprised that he would put trick-or-treating in front of getting his project done, which I shouldn't have.
Yeah.
It wasn't as glorious as Day of the Dead event, so no.
Did you dress up at all?
I did. I dressed up, but I don't think anyone got my costume. So
What were you dressed up as?
I went as the rapper. You know who Ty Dolla Sign is?
Yeah.
Dressed up as him, but I don't think anyone got it. So
That's funny.
he's like 6 foot too. So. Did you do the did you dress up for Day of the Dead event or you just?
No, but my costume was like a skeleton. And we had like a lunch event like on campus here. And so I made like condom goodie bags and I gave those away.
Cool.
Yeah.
Well, we're gonna start soon, everyone. Well, hi, Lori. We're gonna start
Hi,
soon. How are you?
I'm doing fine. How are you doing?
I'm great. It's just enjoying this post Halloween, post Halloween candy. See, I'm just snacking on it myself.
Yeah, you know, it's really funny not having young kids anymore. It's just less of a focus than it used to be.
Do you guys still get a lot of trick-or-treaters, or?
No, you know, it's really diminished over the years, and I'm not sure why that is. I think if Halloween had landed on a Friday or Saturday this year, we would have had more. But we only had like a handful, and that's how it's been the last couple of years. So I'm not quite sure why.
I agree. I think most of the kids around me are growing up. So I guess they're getting out of that phase of Halloween. I guess they think it's less cool now. I don't know.
Yeah. Well, I think there are more events now that are held at community centers, and you know, families have parties and stuff like that. I think more of that's going on.
Yeah.
A friend of mine posted something interesting yesterday. I guess she's a teacher. She was saying a lot of her kids didn't show up to school yesterday because Halloween tends to be a big gang initiation day, and parents are scared to have their kids like walk to the bus stops and things like that.
Oh no! Oh gosh, I didn't know that. That's pretty sad.
It depends on the area and whatnot, but just like something interesting to think about.
Yeah. Jeez.
Yeah. Sorry to darken the mood there.
Just enter into the chat box.
Just a minute or two. Thank you.
No, we can mute it though if we want.
don't understand how that's working. Lori is with the Oregon School-Based Health Alliance. Okay. She's the executive director. Okay. Amanda is
All right, good afternoon, everyone. We're going to get started. Happy November. I can't believe that it's already November 1st. But welcome to the November Hallways to Health Learning Collaborative Call. Thank you, as always, for spending part of your day joining us on this call. And we will thank you, everyone, for typing your names in. We'll be taking attendance a little bit later in the call. And we'll get started.
Well, hi all, and thank you again for joining the call. We do understand it can be challenging meeting virtually, but we see it as an opportunity to connect and share without traveling. So hooray for not spending money. All right, so before we get started, let's go over a few housekeeping rules and reminders. Please mute yourself if you aren't sharing. We are recording the webinar, and we would like to reduce background noise that it will be picked up. So to mute yourself, on the control panel, next to your name, there will be a green or phone icon. You can just click it, and it will strike through with the red mark. That will let you know that you're clicked. And once you're ready to share or ask a question or something, just click that icon again, and you'll be unmuted. Now, if you're experiencing technical difficulties, you can't hear anything, or you have a comment and don't want to interrupt, please use the chat box. We will be monitoring throughout the call, so please make use of it. And before each call, we did send out an agenda, so we ask that you actively reflect on the questions and comments that are in it. We are looking forward to hearing what you have to share, any new details or developing efforts that you guys have going on, or even if you have to ask for or asking for guidance. And outside of the call, we encourage you to use Basecamp to continue the momentum around sharing, learning, and discussing with your hallways peers. Thank you again for spending time today to join our call, and now we're going to move forward.
Thanks so much, Nataki. That was great. It's my pleasure to introduce LaShonda Mansfield, who's joining us from Whiteford Elementary as the new health educator and as a new part of our Hallways to Health team. So, LaShonda, do you want to say a word or two about yourself?
Sure. Can you guys hear me? Hello, can you?
We can hear you.
Okay, great. My name is LaShonda Mansfield. I recently got my master's in public health, 2015, I'm sorry, in behavioral, social, and community health. My passion is to eliminate health disparities through health education, and I love to draw and knit.
Awesome. Sounds like a great asset to have for a health educator. And we're so happy to welcome you to this cohort. It's been a really great cohort of health educators, PAs, clinic supervisors that have been working on Hallways to Health for the last few years. And, you know, one of the things about the opportunity for us to meet as a learning collaborative is to share best practices, challenges, and resources with one another on the call. So, LaShonda, I encourage you to do that as well. And we're excited to have you as a part of the conversation. And if you're just joining us, please be sure to type your name in as you log in, and so we can keep track of who is here and who is on the call. So as Nataki mentioned, I sent out an agenda for the call last week, and our call today will focus on evaluation and connecting school-based health center work to academic outcomes. This is a topic that we've heard a lot of interest around, and we've heard a lot of interest and enthusiasm and requests for support and technical assistance around designing evaluation, what types of measures and metrics to use, and to think about connecting your work to the work of your educational partners. So that being said, our objectives for today include understanding the complexity of school health evaluations, strategies to assess school-based health centers and academic outcomes, and learning from each other on best strategies for advocacy. And to do that, we will welcome here two wonderful researchers and evaluators, Sarah Geierstanger and Samira Salam-Panur. I think I'm not pronouncing your name correctly, I apologize. Samira Salam-Panur. So again, we'll use this call a little bit differently, and we'll talk a little bit about evaluation, and then we'll have an opportunity to discuss what's working for you in your sites and what types of tools and resources you're using, and what types of additional support you could use from the Alliance as well as the rest of the cohort as well. We encourage you, again, to use the chat box as a way to respond and to take full advantage of this opportunity to speak with Sarah and Samira and to ask questions as well. So without further ado, I'm going to turn it over to Sarah and Samira. And Sarah, would you like me to keep the controls, or do you want to take them over?
I would like you to keep them, if that's okay.
Sure. Okay.
We can just, next slide.
Yep.
Great. Hi, everybody. This is Sarah Geierstanger. And Jordana suggested that this would be a good topic to talk about with you because there's been some interest expressed in evaluations over the past year. So we kind of tried to think about topics that might be most relevant to you. However, at the end of this, if there's other information that you'd like us to talk about in the future, we're happy to, because there's so much in school health center evaluation that we could talk about. But today I'm going to give you a very brief overview of what we're thinking about for Hallways to Health evaluation in the coming year. And then we're going to talk about evaluating for school health and academic outcomes, some of the challenges that are inherent to this process, run through a list of potential methods, and then really the focus will be on how some potential strategies to look at the impact on academic outcomes. And then as Jordana said, we'd like to open it up to hear your questions and how any of this can apply to your site and how we can support you. Go ahead, Jordana. So here, this slide gives you a little snapshot about what we're thinking about collecting in the progress report. So now last year they were collected quarterly. This year we're just going to collect them twice, in January for the period June through December, and then in June, or actually July, for the period of December or January through June. And we're really going to focus on the 3 domains of Hallways to Health. The first column on the left shows what these domains are: the food insecurity, improved healthy eating, active living, and then improved student social and emotional wellness, as well as school staff health and wellness. And as before, we're going to ask you to provide some evidence of your efforts in these areas. We want to keep this pretty simple. We're not going to get too detailed, but just how many programs were implemented, what kind of programs, number of students reached, etc. Just some fairly basic process measures just to document the efforts that you've put into these 3 areas. And then we're going to really try to focus on evidence of sustainable outcomes, because we got a sense that Kaiser is really curious to know how the lasting impact of Hallways to Health in your schools. So I just put some examples in here of types of evidence that we'll be looking for. These are, changes in policies and protocols that will outlast this current funding cycle. And I know you've already reported fantastic examples to Jordana last year. And in our final evaluation report last June, we're certainly going to build on all of the evaluations that have been conducted in prior years to really tell the story of Hallways to Health. And we're going to probably create some kind of issue brief, just 2 or 3 page that can be put on the web page that you could perhaps share with potential funders, just to give them a really nice overview of what Hallways to Health is about. because we found that these long evaluation reports are not as interesting anymore. So we will certainly create a long evaluation report for Kaiser as required, but we're thinking that for your purposes and to share the story, something briefer would be nice to have. Can you go to the next slide, please? And this is still a tool that's in progress, but we're thinking that next spring it might be useful to administer to you all what we're calling the School Health Wellness Assessment. Because from our discussions we've learned that when we talk about the lasting impact on school and population health as a result of Hallways to Health, we need to look at your school and community partnerships. And there's several tools out there that we're going to draw from to look at the quality of these partnerships and how helpful they've been, both, as I said, within the school and more broadly in the community. Certainly, we've heard that you're impacting the school climate. So we're going to ask some questions about your perceptions of how the school climate has changed since the inception of Hallways to Health in your site. And then also, if there's been any impact on school wellness policies. So we're going to start drafting this, and probably will ask for some feedback from you all on if the questions seem appropriate and if they'll help tell the story of Hallways to Health. So you can stay tuned for that. We're just getting started with that assessment right now. Okay, thank you. So now we're going to shift to a more broad discussion of school health services evaluation. And I'm probably preaching to the choir here, and you all understand why evaluation is important, but just to reiterate, certainly for your internal program planning and improvement, it's really helpful to see metrics of numbers of students reached, et cetera, as well as the impact on client and student outcomes, so you can improve the quality of what you're doing. And then stakeholders need to see, like at your site administrators, school site administrators need to know what you're doing, as well as using the data for fund development and policy advocacy. Okay, you can advance, please. So this graph or chart is something I really like to look at periodically as a school health services evaluator, just to remind myself how complicated this is. I mean, we're all trying to document the impact of our programs on student health and academic outcomes. But to get there, obviously, it's very complicated. Certainly, the health interventions on the top left there impact physical and behavioral health, positive school climate, et cetera, and then that impacts, in turn, student outcomes. And then, but there's also a variety of social and environmental factors that impact that, such as transportation difficulties, low socioeconomic status, chronic stress, neighborhood safety, lack of parental support, et cetera. And then when we think about academic outcomes, there's a whole host of educational factors, such as teacher training and quality, classroom size, curriculum, et cetera. And then, obviously, individual factors, such as internal motivation, self-efficacy, et cetera, also impact positive health and academic outcomes. What we have control over is measuring what happens in our school health intervention, and that's where we obviously target our efforts. And in our reports, we acknowledge that there are all of these other factors out there. But if you could go to the next slide, please. This is why we find that it's in our evaluations, we try to use a few different methods to triangulate our findings so that we can get perspectives from a variety of stakeholders. For example, right now, Samir and I are conducting a pretty large evaluation of school health centers in Alameda County. And we have customized clinic data software that has been created that collects data from the providers specifically on the clients, and it gets exactly what we're interested in for the evaluation. We're also increasingly trying our best to get data from EHR systems to reduce the burden on data entry from the clinic staff, but that's not as simple as we had hoped it would be, but we're still working to get as much as we can from existing EHR systems. We conduct school-wide surveys. In California, we have the California Healthy Kids Survey, which we've customized to include a module on school health centers. There's also the YRBS and other statewide surveys throughout the country. And then we conduct targeted surveys, such as client surveys. We've developed a client survey in Alameda County that asks specifically about client satisfaction with the school health center services, their students' perception of the impact of the services on a variety of outcomes, including academics. We conduct student focus groups and surveys and interviews with parents, school staff, school administrators, etc. And we have copies of all of these tools and forms. And if any of you are interested, just shoot me an email, and we're happy to send you samples of these tools and even samples of our reports that we've developed. But all of our evaluation reports draw from a variety of tools. But over the, for a long time, probably the past decade or so, there's been a lot of interest in academic outcomes. So not just measuring the impact of these services on student health, but what's the bottom line in terms of academic achievement. So a few years ago, Samira and I developed a very detailed guide for the field, and I think Samira might have already, or Jordana might have already shared it with you. But it goes through 5 specific methods on how you could potentially look at academic outcomes. And so today we thought we'd spend a little bit more time talking with you about that, about these academic, how to measure academic outcomes. This is where Samira is going to take over. You can go to the next slide. Thanks. Samira?
Oh, hi. Sorry, can you hear me?
Yeah.
Sorry, I was muted. Okay, so as Sarah said, what I'm going to go over today is detailed in the guide that was developed. So if you've read it front to back, then you're very familiar with everything I'm going to share. But just wanted to start to make sure that we're all on the same page when we're talking about academic outcomes, what we mean. And I think when we talk about academic outcomes, we generally think of the traditional measures of academics, which are attendance and grade point average and test scores. And that's what folks want to see improvements in. But we like to look at academic outcomes from a much broader perspective or broader sense, and think about also the time a child spends in the classroom, their behavior and disciplinary referrals, and also mobility in terms of moving in and out of the school, graduation rates or dropout rates, and the broader school environment. So really there's a broad range of indicators that play into academic outcomes. It's not just the test scores and the grade point averages. Next slide, please. So what has the existing research found? And I'm sure you all are very familiar with this, so I will not spend a lot of time on it. But we know from the literature there's a large body of evidence that supports a connection between students' health status and their academic performance. And oh, there we are. Okay. So we know research has found that vision and asthma, teen pregnancy, violence, mental health, physical activity, nutrition, and dental health are all some of the problems that can have negative effects on students' academic success, and that they tend to reduce students' motivation or their ability to learn. So I think we're all very familiar with the saying that you have to, you need to be ready to learn in the classroom, and all of these different health issues can affect a child's ability to be ready to learn. And we also know that there's a lot of literature out there documenting how school-based health centers can impact these very health issues that then in turn impact academic success. All the ones that I just named again, like vision, teen pregnancy, violence. So we know, and mental health, we know that school health centers and the services they provide can directly impact those, and by impacting those issues, students will have improved academic performance. But there's less research documenting the direct link of school-based health centers and academic indicators, all the outcomes that we just reviewed in the previous slide. And Sarah and I in the guide, and since the guide was published, have been watching the literature on academic outcomes, and I think there's probably about 10 studies that look at the direct link between school-based health centers and academic outcomes. So there's just not a lot of research out there. But the studies that are out there have found positive impacts on attendance and grades, and then also some of those broader indicators such as school climate and school environment and students' resilience factors or assets. So there's literature, there's it's sort of a baby, we've made baby steps towards documenting this link between school-based health centers and academic outcomes, but there's definitely more work to be done to beef up that literature. Next slide, please. So again, we're going to talk about strategies of how one could document the link between school-based health centers and academic outcomes. And these are just a few of the strategies that Sarah shared that we do with our evaluations in California. A couple of the strategies, and then we'll give you some sample questions that could be used within each of these strategies if you are interested. And again, in the guide that we wrote, there's actually samples of each of these tools in our guide if you want a more detailed list of questions that you can add. But the school-wide surveys that Sarah was referring to, so we have in California the California Healthy Kids Survey, and nationwide there's the Youth Risk Behavior Surveillance System, and these are surveys that folks use to assess risk behaviors and assets in youth, and they can be tailored to include questions related to the school-based health center, and specifically the school-based health center and its impact on academic outcomes. So one of the questions that we've asked in our survey is we ask students to tell us if they're a school-based health center client, and then also to tell us if the health center has helped them do better in school on that school-wide survey. So we get a large sample from the California Healthy Kids Survey for this data point. In your targeted surveys, so Sarah referred to client satisfaction surveys that can be administered. Again, we can add questions that are related specifically to academic outcomes to these surveys. So we have an example here: the health center helped me to concentrate better in class. Any sort of questions like these you can ask of your clients, and it gives you good data from their perspective on how receiving services from the health center has helped them in school and with their educational outcomes. In student focus groups, largely we ask students to give us feedback on the school health center services and what they would improve or what works well and what doesn't, but you can very easily also ask questions from the student's perspective about how the health center has helped them with their academic outcomes, again, in terms of missing less school or other from that list that we talked about, other issues, get their qualitative perspectives. And for stakeholder interviews, for school staff or parents, we can ask, again, get qualitative data on their perspectives about the impacts of school-based health center services on students in terms of things like what changes in students' behaviors or attendance have they seen since the school health center opened, or for clients and specific clients that or students they know are using the services, have they seen changes in behaviors or academic behaviors or attendance. So those are some really easy strategies to incorporate. And then I'm going to talk about two more strategies. The first one I'll talk about is a very simple one that we've used in Alameda County, and I know folks across the nation are implementing this. It's a very easy piece of data to collect and provides very valuable data in terms of the impact of the school health center for stakeholders, particularly on the education side. And then we'll talk the next strategy we'll talk about is a much more detailed strategy that involves a lot more work. But this is an easy strategy for school health centers to implement to document academic impacts. And we call this the client disposition log. So basically all you're doing is you can have a log that your providers complete for when a student comes in to get a service from the health center. You track what happens after that visit. So were they sent back to class? Were they sent home? Or were they sent somewhere else, like the ER or to another service? Or is this not applicable because they're an adult or community member, or it's summer and they weren't sent back to class, or they weren't missing classroom time? But just by documenting this one piece of information, what we're getting at is the value of school health centers in terms of keeping students in school and in the classroom. Whereas if we didn't have a school-based health center on campus, the students would be either sent home or sent would have to go to a primary care provider off-site and miss more school to get a service that that the school-based health center provides. So we track the number of students who are sent back to class, and in Alameda County that percentage has always been about 85% of our visits or so are sent back to class. And that number in and of itself is a great number to show to educators or folks on the education side that we're, because the schoolhouse center is there, nearly all of our visits, the students are going back to class and not missing much time in the school day, and we're saving them classroom instruction time. But you also can then turn this into a couple of other pieces of data that are interesting to report for your stakeholders. If you also track the time the student came into the health center and the time that they left the health center, so let's say the student came in at 8 a.m. and left at 8:45 a.m., and you know the school day ends at 3 p.m. So we know then, actually you just have to track when they left. So if they left the health center at 8:45 and the school day ends at 3 p.m., we have saved that child 9 hours and, I'm sorry, my math is terrible right now. We've saved that child 5 hours and 15 minutes of classroom instruction time rather than them having been sent home and missing those hours of school. So if you do that for all of your client visits, let's say I have 100 visits where I'm saving the child 5 hours a day of attendance time, add that up and you've saved the school 500 hours of classroom instruction time. So again, that's a valuable data point that you can share with your stakeholders. And for the folks who are more visual, again, there's a sample of this log in our guide that you can refer to, and also sample calculations that you can use to get these data points that I'm discussing today. And then one other way that we have used this data point is that in California, schools will receive daily funds for each student to be present in school, and I think it's about an average of $50 a day for students who are present in school. So you can turn that number, that same number, let's say we saved 500 students from being absent from school or being sent home. You can multiply that by your average daily attendance, so 500 visits at $50, we've saved $25,000 for the school because the schoolhouse center is on site and students are not being sent home and being marked absent that day, therefore losing the school money. So again, those are just 3 really easy data points you can use, and compelling data points. It's not rigorous science by any means, but for marketing purposes or just demonstrating the value of the schoolhouse center and academic outcomes, it's definitely compelling data. And we've had good feedback from folks who we've shared that data with that it is good data to share. So the other strategy that, thank you, the next strategy that I'm going to talk about is pretty labor intensive, and for folks who really want to do the other side of, I just shared with you a way to collect and share data that's not rigorous by any means in terms of data collection and analyses, but this is sort of the other end of the spectrum. If you want to collect some really strong data to demonstrate academic outcomes for school-based health center users compared to non-users, the way to do that would be to link a data set from the school health center on students who use your services and what services they use, to be able to link that to a data set from the school district that includes data on demographics and academic indicators like attendance and test scores and grades. So we've been wanting to do this with our evaluation for years, and we've done it on a small level for mental health users in one school district. But it's very intensive, and there's a group in Seattle who's done some really great work implementing this type of data linkage between health and academic data, and they've published some papers on their findings. So that's a great example to refer to if you want more information, and I think I know the reference is actually in our guide as well. But to do this, you would have to, ideally you would start with a data set from the school district that you can upload into your school-based health center database so that you have an identifier for each student enrolled in the school preloaded into your data set before you start collecting data for the year. And so you go along the year and you're collecting data for each student who comes into the health center on what types of services they get and how many visits they have and all sorts of different exciting data points. And then what you can do is at the end of the year, because you have that identifier from the school district, you can ask them for a data set on their academic indicators that's also identified by that same identifier do emerge at the end of the year, and now you have this beautiful data set together that where you can look at academic outcomes, and you also have a built-in comparison group for the students who don't use the health center and don't have health data. If you wanted to look at changes in attendance for school-based health centers users versus non-users, or if you want to look at changes in grades and so on, you have a built-in data set, because obviously the students who aren't in your school-based health center data set are quote-unquote non-users. So to make this work, the best thing to do we've done very lengthy presentations on this data linkage, and I'm not going to go into too much detail, but the best thing to do is to have a data sharing agreement between the school and the school health center, each of the health agencies providing services in the school health center, but to work with a third-party researcher. And the third-party researcher is key here because they're able to collect data from both sides without having to worry about the HIPAA and FERPA challenges that you may face if you're a school-based health center. Basically, school-based health centers don't want to release to a school district who's using their services because that breaches HIPAA, and the school districts often don't want to share a full data set with the health center because of FERPA regulations. So by having a neutral third party that receives both data sets, no one on either side is going to get data that they shouldn't have access to. And the third party never has to see names, so all they have to see is that one unique identifier that's shared between both data sets to make the link, and it keeps things confidential. And there is a exception in both HIPAA and FERPA for this type of relationship if you have a third-party researcher collecting data from both entities for research purposes. So I think that's all I'm going to talk about in terms of this diagram and this strategy, but definitely we'll have time for questions, and if folks want more detail on how this works or have questions about the HIPAA and FERPA regulations, I'm happy to answer them after we're done. And I think I have one more slide to talk about the challenges of doing this work. So there are some inherent challenges in collecting academic data to show the impacts of school-based health centers. And one of the biggest challenges in doing this work is that our study design factors can skew results. So just by nature of school health center services, students opt in to receive them. So already we have a motivated group that wants services, so they may not look like non-users. And other design factors that can skew our results are in terms of well, so again, it's more about who opts in for services that can definitely create some issues in terms of finding a comparison group or looking at our data. So there's some issues that you have to think about when designing an evaluation, and you want to be able to collect data to sort of offset some of those challenges. You want to get at some, if you possibly can, use surveys to collect data around motivation to receive services or where else students might be receiving services, and that way you can have a good profile of who your users and non-users are. Another challenge that we've come up with in terms of demonstrating impacts is that not all clients receive enough services to make a difference. So we have those, those students who just drop in for one service and don't come back, or maybe one or two services, but it's not enough to demonstrate that we're making a difference in terms of their academics. So the best way to overcome this challenge is to, if you're doing a survey, you want to ask students how often they use the health center, and then two, you can filter out and look at those who are using the services more frequently and focus on that group to see if there's changes in their academic outcomes or their self-reported impacts on their attendance. Another challenge is that gaining access to data can be very challenging. Again, the challenges of HIPAA and FERPA and obtaining data from school districts, we are very experienced in those challenges ourselves in our evaluations and throughout California. So again, the third-party researcher I think is the best way to overcome this challenge. But really just obtaining buy-in is, I know I'm preaching to the choir here, obtaining buy-in and building those relationships to make sure that everyone understands how data is going to be used, who's going to have access to it, where it's going to be stored, and just being very transparent about which data, how data is being handled and what will happen to it in terms of evaluation uses and how it will be destroyed once you're finished using it. And another challenge that we've seen also is that positive effects are not always found. So, you know, we always say any finding is an important finding. So not finding effects is okay too. And I think, again, one of the ways to overcome this challenge is to look at subgroups of students who are using the health center and see if you find effects there in terms of improvements in academic outcomes. That's going to be the best way probably to overcome this challenge. But again, if you don't find impacts, that's a telling finding as well, and maybe that things need to be changed a bit to create some more positive effects. So just to sort of wrap up this very brief introduction into demonstrating how school-based health centers impact academic outcomes. Why do we do this? And Sarah shared this with us at the beginning of the presentation, but more and more educators and all stakeholders want to see the impacts of school-based health centers on academic outcomes and the value of school health services. So using any of the strategies that we talked about will help you to make the case for these services. And also, if you are able to collect enough data so that you can hone in on those subgroups of students who are using different services, it can help you target your services better for those students. So, like for example, we look at high-frequency users of our school-based health centers to see what their risk profiles may look like and what services they're receiving, and we can give that feedback to the school health centers to maybe target those groups or change their services to be more effective to impact that subgroup's outcomes. I think that's it for my slides.
Yes, that is it. Before we go into kind of discussing how we might use some of these tools in Hallways to Health and discussing Hallways to Health specific types of challenges that are outside of raw clinical data that are applicable in your population health work, I wanted to see if anyone had questions for Sarah and Samira on the presentation, or if you have any comments on using a client disposition log or in anything that they presented about how they are linking academic outcomes to school-based health center. You can take a minute to ask any questions or comments in the chat box. And while you're taking a minute to do that, I just want to really thank Sarah and Samira. This is a great presentation. It's great to know what type of research and evaluation is being conducted at the school-based health center level, and in thinking about ways to link with the academic outcomes. And as Sarah said in the complicated diagram slide, it's important to recognize that our interventions aren't the only thing that are happening, but that they are a contributing factor, hopefully, to improving some of the academic outcomes as well. And how cool is it that some places you can show the data, and a third party can, like Sarah and Samira, can look at the data and talk about the impacts of school-based health centers and compare it to a group that is a non-user. So the floor is open for questions and comments. And Sarah and Samira, you're also welcome to share any other thoughts that you have as well.
Jordana, this is Sarah. I just wanted to make sure you did send out that booklet to everybody, right? I think after our last phone call.
I did, and I think I will send that out as a follow-up to this call as well, so that folks can reference it when they're going back to these slides too.
So, like I said, that goes in a lot of detail on each of these methods, and it does contain more of a summary of the literature, at least at that point in time when we wrote the guide. And as Samira said, there have been a couple more studies at least that have been published since then that we haven't updated it.
Okay.
But just a reminder also, as SBHA members, there's a link on the SBHA website. We created last year a literature database on the SBHA website. So I think you can search for academic outcome in there, and you can have access to summaries of these articles if you're curious to go into more detail.
Yeah, thank you so much. This is a great great summary of all of the types of research that talk about evidence for all of this type of work. So we have two questions. The first question is to Samira. If you could explain a little bit more about how to work with some of the HIPAA and FERPA restrictions that you talked about, especially if there's not opportunity to have a third party evaluate our.
Sure. So I have to say that the best way to, I'm choosing my words carefully because I don't want to say, it's not getting around HIPAA or FERPA. Actually, so let me back up. The best way to do this to make sure that your bases are covered for HIPAA and FERPA is to obtain parent consent to access data. That's going to be the, if you don't have the help of a third-party researcher, if you can get a parent release form to release data to you, to agree to release if you're on the health center side, to get a release form for them to release academic data to you, you can, if you have a relationship with the school district and they're on board, you can provide them a list of students who, or you can just provide them those consent forms, and that gives them the authority to release data to you. So getting parent consent is going to be the number1 easiest way, or most, the safest way to access this data if you don't have access to a third-party researcher. So that would be my first recommendation. Second, if you don't have a third-party researcher involved and you still want to do this work, it just involves a lot of relationship building with the school district to sort of convince them to give data to you, because there is so the school health center can never give the school district a list of students who use the health center. That violates HIPAA, and you never want to go in that direction. The school district, if they are interested in this research, can ask. And there's actually, I'm by no means a legal expert, so there's definitely publications that I can refer you to that talk about this data sharing between the school districts and the health centers. But there is an exception in FERPA if the school district wants to evaluate the effectiveness of their programs on their students' outcomes. If they invite that research, they can release data to you. So the school district has to initiate wanting to engage in this research to look at the impacts on services that they provide to their students. By that sense, if they're initiating, they can share data. And again, so the problem here is that you have to have a good relationship with them, that they're willing to release to you a data set that has academic data on all students in the school, because you'd never want to give them a list of students who are clients of yours and ask only for data on those clients, for example. So again, I would highly suggest, if you don't have the help of a third-party researcher, you're going to want the help of a lawyer instead. So I don't know, it might be easier to seek out a third-party researcher, but there are exceptions, or they're not even workarounds. They're actually, I mean, there are legitimate ways that data can be shared across entities to be able to make this link between academic and health data. But again, it can never be initiated on the school health center side, and you should never share data from the school health center over to the school district unless you have a release form from parents and students themselves saying that you are able to do that. Does that help?
Yeah, thanks. That's certainly it's a complicated situation, which a lot of school-based health centers have.
Yeah, it is, and I think that's why we don't see a lot of this work nationwide, and we don't see a lot of it in the literature as well. As I said, the folks in Seattle who did this, they had a data sharing agreement between the Department of Public Health and the Department of Education, and a very close working relationship to be able to conduct their research. But we haven't seen, I believe that theirs is the only research we've seen in the literature where identifiable data was accessed to be able to look at both what types of services on the health center side students were using and link that to their individual level academic outcomes. So it's challenging work.
Yeah, certainly, and I think, when we get into discussion in a few minutes, we're also going to talk about the challenges of doing some of this population health work where even less data is available because everyone's not a patient utilizer. The next question is kind of back to your schema of an ideal where you're integrating the data, the academic data, and the SPHC data. And the question is, when you talked about making a difference, is that reduction in BMI or an increase in grades? And who's like kind of the deciding factor? How do you decide, or do you have any suggestions about navigating the priorities between the federally qualified health center priorities and the school priorities in terms of what type of data you're collecting and what type of data you're reporting on?
Molly, I saw your question in the chat box. I think it's a great question, and it's one we, as evaluators, struggle with all the time. How do we focus? How do we decide what to collect? Who are we trying to speak to here? And in Alameda County, I can tell you, we collect a ton of information in Alameda County on a variety of services and academic outcomes, et cetera. And, we're just in the middle right now of creating an issue brief where we're trying to summarize what we think are the most compelling findings. In Alameda County, they use the RBA framework, results-based accountability. So how much did we do? How well did we do? And is anyone better off? And we decided that what folks really care about is anyone better off? Like, they don't need the bean counting stuff. And and I'm happy to share this with you when we finish it. Hopefully it will be done soon. But we decided to focus on the impact on universal access to health care. So we included, an increase in clients, increase in visits, improvements in insurance coverage, et cetera, and client satisfaction, which is also an indicator of access to care, because if they like it, they'll come back. And then our second area was improved behavioral health, because we have some good data there around the impacts of the services. And then the third is the academic outcome piece. That seems to be really interesting. But then your question about, weighing the priorities of your medical lead, your FQHC, versus maybe what your school wants or what your school health center staff want, that's a challenge because, yeah, the FQHC is interested in billable visits. So I don't have the answer to that, a great answer for you, Molly, but I can say that at least in our Alameda County evaluation, we're in constant discussion with our funder, with the Alameda County Healthcare Services Agency, to find out what they think will be interesting to the Board of Supervisors who's funding these school health centers. And every year it seems to shift a little bit in terms of what they're most interested in. And so, when we think about Hallways to Health, as the evaluator, I'm particularly interested to find out what Kaiser wants to hear, what will make them think this was an effective program, so maybe they would continue funding it, or programs like this. Does that help answer your question at all?
I know she's having some audio issues.
Okay. And then another way we've been focusing our energies is, the NQI, the National Quality Initiative that the School-Based Health Alliance is spearheading. We've trying to focus on 5 core performance measures that we're hoping school health centers across the country will start collecting uniformly, so that we can have some standardized data across all the sites. And if you're interested in that, we can give you more information on what those 5 measures are. But that's one way that might help school health centers narrow their focus on what they're collecting.
Yeah.
Yeah.
So she said that is helpful, and was also just wondering if there's any examples of pilots that could be shared with California where you have successfully linked academic data and health data. You spoke about Alameda, your work there.
This is Sarah. I don't know if Samir's on, but Molly, we can share you our reports from Alameda County, and then in terms of specific schools that have been doing this. I mean, years ago, Roosevelt Middle School was the first to do the seat time log. We used to call it the seat time log, the client disposition log. And then you also mentioned Attendance Works, and that's, I would love to talk with you separately about your experience with that, because that's a fantastic system built in.
Sorry, this is Samira. I was on mute again. But we have, so Molly, we can definitely connect offline too. The only time that we've been able to do this successfully in Alameda County was with Fremont Unified School District, and it was focused only on mental health clients of the mental health services in Fremont Unified School District, and it was basically set up just the same as we're about to embark on this little study in West Contra Costa. So we received consent from parents to be able to access the health and the academic data, and so we were able to, with parent consent, give names of students to the school district that we were allowed to access data on, and we're able to look at academic indicators for them, and they also gave us, I believe, a data set stripped of names or identifiers to look at the entire school as a comparison group. And actually, I say that out loud, and we did this in Oakland as well. And Oakland was the same. We did it with parent consent. So it's how we've set up the work in West Contra Costa, is with a parent consent to release both health and academic data. But I'm happy to dig up the write-up that we did on Fremont. I don't know that we had a formal write-up for the Oakland work, but we did for Fremont. So I will take a look to see if I can find that.
Thanks. I finally figured out how to unmute myself. Hi, Samira. It's good to hear your voice. Yeah, I was like taking advantage of having you on another phone call because, yeah, we're struggling with getting approval from all the players in West Contra Costa, which is like our biggest hurdle to overcome. So we have to get approval from the district, and then because of the way the county is set up, we have to get approval from the county, and then the actual sponsoring agency. So there's three big kind of bureaucratic barriers to getting release of information for students. So yeah, that's parent consent trumps all though. So it's just kind of figuring out how to make sure that everybody's on board with that. So yeah, that's helpful. Yep. And yeah, I just wanted to know if there's any other examples that I can keep giving to our partners in West Contra Costa. This not be the first one.
Molly, I think that the folks in LA have been able to successfully do this. At least
the
they
LA
have
Trust?
data.
Okay, yeah. I'll reach out to them too.
Yeah,
thank you.
Kim. Yeah, I spoke with her at a conference a month or so ago, and she had said that no, it was the California Alliance conference that I saw her at, and she said that they actually were able to link the Wellness Center client data with their academic data. They just didn't have the staff to do the analysis, at least at that point. But
oh, great. Okay, and she's with the school district, so that's awesome.
Yeah,
okay, thank you so much.
Yeah,
taking many, many notes. Thanks, guys.
Yeah, call us if you figure something out or want to talk about it more.
Thank you so much. That's a great discussion. Clearly, there's a lot of really great things that you can do with data, and Sarah and Samira and Molly were all talking about things that they're working on in order to demonstrate the value of school-based health centers, and that's even the traditional operations of school-based health centers. In this initiative in Hallways, we've asked you to move outside the clinic walls. So even thinking about a little bit differently, what we can do, again, to assess, to demonstrate the value of the population health work we're doing, and as Sarah mentioned at the beginning, to be able to talk about the programs and policies that we've implemented, the evidence of our efforts. So again, how much we did, what we did, and who we did it for, and the evidence of sustainable outcomes, and talking about whether policies have been implemented, whether processes and procedures have been kind of put into place, is a little bit of a different story and may have different challenges associated with it. So, not everyone, not all school-based health centers have the wonderful luxury of having third-party evaluators to look at your school-based health center and look at the work that you're doing. And we know that as Hallways Health leaders, that you guys are often the champions and the sole voice of your efforts. So I just thought we could have a little bit of discussion about what evidence would be useful for you in advocating for continued funding of Hallways to Health, and what types of information do you need to show the value of working outside the clinic walls to demonstrate to your school partners, to demonstrate to your sponsor agencies, and to demonstrate to other stakeholders? So what types of data do you think would be useful for you to advocate for what you've been doing? You can call them out.
This is Mandy from Seattle, and I would say that establishing benchmarks for their data and then academic improvement as well as outcomes combined with anecdotal evidence and stories from our students.
Mandy, it was a little bit hard to hear you. You said establishing benchmarks about what?
For our data, so before and after benchmarks essentially, and then anecdotal stories from our students, health outcomes, or how we've been able to mitigate potential downfalls of the students' academic and health performance.
Yeah, and those types of things are hard to talk about as well, especially if you're talking about the work that you're doing in terms of prevention. But certainly a data story that would involve a before and after picture, a student or group of students' anecdotes, as well as talking about health outcomes overall, would definitely be a compelling story. Anyone else? Someone said they agree with Molly. They agree with Mandy. Has anyone had any success or used any great templates or reporting forms that have been successful in capturing any of the stories or anecdotes? And this is something we've been thinking about for school-based health centers for a long time. And what we're actually going to do is spend one of our upcoming learning collaborative calls working on some tools and tips for storytelling, and also be bringing a storytelling training hopefully to our in-person convening as well. So we'll be working a little bit on helping capture and tell stories, but I'd love to hear if anyone has useful templates for those.
Molly, in Alameda County, this isn't very fancy, but in our progress reports that the sites provide to the county, we ask them to include a successful client story about how the services have impacted the client, and we go through those and usually highlight a few in our reports. It's just an easy way to get some examples.
Yeah, great. Thanks, Sarah. And actually, in the reports that you guys have all submitted in the past to us, we've been getting some great stories. But helping people think about how to get stories and how to voluntarily give them when it's outside of their regular operations continues to be a challenge for school-based health centers. Definitely interested in hearing more about that. So other than benchmarks of before, after, Mandy, maybe you can tell us a little bit more about that. What types of benchmarks would be useful for you to talk about the work that you've done as a result of Hallways to Health? What types of metrics would you want to see have changed from before and after?
Sure. So maybe the number of suspensions and detentions and other items such as that were utilized before Hallways Health got involved, as well as a number of days in the school attended, and then obviously measuring at the other end, hopefully improved attendance and diminished suspensions and detention.
Right. So getting back to linking to academic outcomes and in a way that's probably both broad and accessible. So you know, Hallways to Health has been going on for 3 years, so you may not have the same students, but generally looking at attendance rates and discipline rates. Is that what you're talking about? And then making an association? Okay, great. Yeah, because, I think, it's challenging, and I think we need to think about what is accessible, easily accessible to you. We know that you're doing so much programmatic work, and you're in the schools, and you're running health education classes, you're running mindfulness trainings, you're working with your school employees, and now we're going to ask you to be thinking about sustainability as well. If your school-based health center isn't already capturing data, if you're not already doing client logs or records of, or looking at other records or using other assessments, you have to think about what is easily accessible to you and what's also captures your student population who you're serving through Hallways to Health efforts, because you're not only serving the clinic utilizers. What else? Is there anything else that would be useful to advocate for continued funding? Okay. So how else could you get this evidence? We talked a little bit about collecting stories, and we have to think about how to do that. We talked about getting some of those benchmarks. Sarah and Samira mentioned school-wide surveys, targeted surveys, adding existing questions to already existing evaluations, student focus groups. What are the best ways that you guys can get some data from your school about the Hallways to Health impact?
This is Kylie from Milwaukee High School. One thing that we're really fortunate to have the infrastructure is our Youth Advisory Council, which is a group of 15 to 20 students who have kind of emerged as health leaders within the school. So one tool that we've been able to use is to use them to go gather student stories, whether in kind of framing that as a research and practice-based experience for them, whether that's working with photo voice or learning how to do interviews to gather student experiences, whether that's with mental health or nutrition. So utilizing maybe staff members or students that you work with closely that are leaders within the school to gather some of those student stories as well.
That's great. Does anyone else have great ways of gathering anecdotes or information or on health outcomes or the benchmarks? What else are you already doing at your site? I know, Christina, you have used something in the past that you've used a log where you track the types of programs that you're doing and the number of people that came and who you reached out to and who participated. Can you tell us a little bit about that?
I was actually mostly using that in my other role, not so much at Monroe, but it was pretty effective. We're trying to measure the number of sessions we've had.
Great. It's a little bit hard to hear you, but Christina was saying that she's using it in another role, but she's documenting the number of health education sessions and the number of programs and attendance and participation. So talking about the frequency and talking about the reach is a great way to, is a great and pretty simple way to begin to talk about the impact of your work. If you're saying we did one health fair, or if you're saying we went to every classroom this year and touched 85% of the students, or we had weekly meditation sessions, those are very different stories to tell. So that's a great beginning of a story. Awesome. All right, and the last question is really, we obviously are, you've been doing some really innovative work, and we want to be able to help you tell your story the best we can, and we want to know how we can help you. So some ways we've thought about that we could offer assistance in this area to help tell your story is, first of all, to offer, evaluation office hours, which we'll continue to do. And if there's need and interest, we're also available, by email and everything. I'd like to share at the end of the project, as Sarah said, kind of like an issue brief on what Hallways has done, and for you to be able to share with future stakeholders. We'd also like to share some existing research on the effectiveness of working in school wellness, school employee wellness, social emotional health, and obesity prevention, and some research on those topics with you. We're going to offer some storytelling training, as I mentioned, so hopefully we'll be able to share some tools and resources and templates to begin to capture some of those stories, as Molly asked for. And does anyone else have any other ideas about how School-Based Health Alliance can help you get the data you need to talk about and provide the evidence for sustainable impact and outcomes for your Hallways to Health efforts? Like, what else can we do? Nothing. We can't do anything. Feel free to email if there are specific ideas, but we are here for you, and we want to be able to help you be the best advocates for this work that you can be, and part of that means learning to craft a story that includes anecdotes, that includes benchmarks, and that includes some qualitative and quantitative data about what you're doing and what you've achieved and who it's reached and the impact that it's had. So we'll continue to do that with you. So just to get a little bit of participation, can I get a volunteer to tell a story about one of these prompts in your school or school-based health center that begins with one of these? We're thinking about capturing stories. So if you can think about one thing this month that you did successfully at your school-based health center and your Hallways to Health efforts, or if you have a story around your school attendance, or if you can share something about students learning, modeling, and practicing something, we'd love to hear.
Hi, this is Bianca. Can you all hear me?
Yes, we can, Bianca.
Okay, good. Yeah, I just did the mute. So we have started our Second Chance Breakfast program last year, and our principal just said he wasn't going to have it because it was creating a lot of, well, the food was sort of being thrown around the school, to say it lightly. So he put a hold to that at the end of the school year, but the students have sort of stepped up this year, and they recognize that in order for us to continue the Second Chance Breakfast program, that they really need to be mindful. So this year, we're just really pleased to say, while we've not started the Second Chance Breakfast, we do have fresh fruit every day in our health center, or I should say on most days. And we just had a conversation with school admin of how they've noted that the students are really much more appreciative of that fresh fruit every day, and they're really not disposing it in a way that they shouldn't be. So it's really something that we recognize, and I think that for us, that's a great success.
That's awesome. Glad to hear that the students are being respectful as well. It's a hard thing to teach to high school students sometimes. Anyone else? Can I get one more story?
Hi, this is Renee from Rice.
Hi, Renee.
So we are working with a group of volunteers from a local hospital, and we will be painting some additional games on the blacktop, so just adding some color and some additional games. That way students have something a little bit more exciting than just the Foursquare and hopscotch. So hopefully give them more incentive to be active during recess and lunch times.
That's great. Love Foursquare. How about the first prompt? One way I stepped out of my comfort zone. Okay, well, take this as a note to think about ways to tell your stories and to connect with them. It's important at the end of the day to have a story to connect you to your work and to connect your passion to what you're doing and what you're able to achieve. And I know it's hard day to day to think about wrapping it up in these bundles of what you're working towards, but your work is really important and you're doing really, really wonderful things, and we want to be able to highlight them and hear about them. That's really exciting. So just quickly wanted to provide some upcoming project updates. We'll be releasing virtual trainings on sustainability of Hallways to Health, and we'll have some required work to be completed along with these trainings that will be view at your own pace video trainings. So we will be requiring some of the work to be completed and submitted with your January reports, and we'll send an email soon, so keep an eye out with a calendar as well as instructions on where and how to access the sustainability training modules and the associated tools. We'll be providing the login as well. So included in the first module will be preparing for sustainability. So the tools will include identifying and assembling your sustainability team. So who should help you and who should be involved in planning for sustainability, creating a sustainability vision statement, completing a sustainability assessment, and some other associated tools. Since all of the deliverables will be due at the same time as the report, you'll be responsible for pacing your own work, although we will suggest internal deadlines. And you can and should work with your state affiliates for support and assistance on this type of work. And it should be parallel to and complementary to your existing programmatic population health work as well. Our next learning call will be on December 6th, and we'll send out an agenda and preparation for that call prior to the call. And on January 17th, you'll have a report due from the beginning of the year, and we will send a template for that out as well. And again, that will also include some of the sustainability work that you'll be reporting on. Just to provide some clarity, earlier in the call, Sarah mentioned that we will only be collecting 2 reports. So this year, instead of collecting in April, as we had originally planned to do, we'll only be collecting the reports in January and in June. So hopefully that will reduce some reporting burden and allow you to spend more time on your programs and your policies as well as your sustainability work. Thank you guys so much for joining us for this November call. Thank you so much, Sarah and Samira, for an excellent presentation, and we'll look forward to hearing what types of evaluation and data that you're able to collect to link to your academic outcomes. So thank you so much and have a great afternoon.
Thanks, Jordana. Bye.
Thank you.
Jordana?
I'm still on.
Will you be sending the slides today?
I will be sending them.
Perfect.
Yes, I'll send them out today. Yep.
Okay. All right. Yep. Thank you.
Thanks for joining us tonight. Bye.
All right. Bye-bye.
you.